Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. And today, we're broadcasting live from the Health Conference in Las Vegas. Very excited to be here and among the 10,000 or so calling this conference home for the next few days. For this episode, though, my 252nd episode, we are having back on air a longtime friend, but also a very successful digital health entrepreneur, Mark Dorner, founder and CEO of Precise MDX. Welcome back to the show, my good friend.
Thank you, Justin. Appreciate you having me here.
You got it. I'm glad this came together. It's a great opportunity to broadcast live here from the conference, and you being my very first guest. I know we always have lively conversations, so I know this will just be another one. So before we dive in, how's the conference been so far?
Well, I can't believe there's only 10,000 people here. It's a very, very well-attended conference, and it's great to be back at a busy conference again. Specifically, the layout and design this year look really nice. Like how they laid it out, the hallways, very innovative, very techy looking.
It is. When you come in here, you come through a hallway that's just lit up in purple and blue and green and white and yellow, and it's actually a very, very cool ambiance as you walk in here.
Yeah, they have a DJ playing in the lobby. Yeah. It's very, very interesting. But health has always been a very kind of innovative, cutting edge conference.
It has.
Unlike the other healthcare ones, which are kind of more quiet.
More quiet. I like that. Yeah, no, this conference is picking up also a lot of steam. Because people say, well, why do you go to health, or, what about health? What I found is a lot of thought leaders come here, and it's deep learning. And I'm not saying the other conferences aren't deep learning, but here tend to be a lot of on the front end of innovation, where technology is going, and it's evolving. And so it's kind of cool to be here, collaborate with those people, learn where we can, and share when we can, and certainly best practices and all that good stuff. And we'll share some of that today. So on the cool technology side and innovation side, what have you seen so far out there?
Well, I've been walking the show and meeting some companies. There's a lot of really nice patient-focused technologies, consumerism at the show. And I feel like it's a good blend of startups and established companies. So some established companies kind of changing their messaging to be more kind of outreach to consumers, as well as startups approaching it from different angles. We even ran into one of our customers here, Innovative Health Diagnostics. Mm-hmm. They've launched a new direct-to-consumer testing kit line. So it's kind of exciting to kind of see them. I didn't know they were going to be at the show, so it's exciting to run into them.
There's a lot of that. I mean, as I was walking around, basically, I know they'd have a booth there. Not sure why they'd have a booth here. I see that in different areas, but you never know who's going to be here, and so it's kind of cool. I certainly, if you're raising capital, looking for business partnerships, relationships, and just seeing what's out there and growing your business, it's a great show to be at.
Yeah,
so
it's a great place to showcase your product and your message. Absolutely.
Yeah. Very cool. So what cool conversations or meetings have you had thus far? I know, you just got in recently, but what have you seen and heard?
Oh, so many great meetings out of the gate. Everybody here has a very positive attitude and are here to collaborate, really. One of the ones that stood out is I met I call them a science company. They do research. They're focused on precision medicine, Genomind. Mm-hmm. They've been in the pharmacogenetic space for over a decade. Pharmacogenetics, also known as PGX, it's a field of research that studies how a person's genes affect how they will respond to medication. So the long-term goal is to help doctors select the right drugs and dosages that best suited for each person. So it's kind of a fascinating field. Mm. They've been in it for a while, and it's getting a lot of steam in recent years.
What's an example? What's an example of PGX?
I mean, my mom, for example, was prescribed medication by her physician. He had her go do the test, and I asked him, well, why we're having, this was before I've met these companies, why are you having to do this test? He said, well, certain people as medicine advances, precision medicine, genetic research, genome sequencing, we found certain genes that, will tell us if, one medication versus another will be more effective for the patient. And even in some cases where a medication could be fatal. Right. Because the gene, they have a certain gene they carry. And you can know this up front. So it's pretty cool.
That's very, very cool. I know that's making its way in, as is getting out of the EHR industry, we're putting some of that content into the EHR so we can have it at the forefront of clinical care. When you're meeting with your doctor, you might have some of those results right up there, right at the fingertip of the doctor, right on the screen.
Yeah, and it's all about access to information because physicians, they have to carry a lot of information around their head about to treat patients, different conditions, depending on the specialty. They can't know everything all the time.
Right.
So being able to present them with that information to say, oh, you're about to prescribe a certain medicine. Did you know? Latest research shows. Just do this test, and then you might make a change in your clinical decision making.
Yep. No, and that's obviously, a lot of my listeners are in this space and deep in this space, and so they know that this is the future of where healthcare is going. Precision medicine, it's everywhere. Mm-hmm. It's it's not when, but almost how do you integrate it into your platform? How do you access it as part of your journey for how you're building your technology and innovation, and how do you leverage it best? Because patients are going to demand it, providers are going to demand it. It's part of our future. It's really important for care.
Absolutely.
So, very cool. Overall, and we'll continue to dive in, but what do you hope to achieve here at the Health Conference?
Well, I attend these conferences to kind of keep up with what's new in healthcare technology space, as well as, look for, companies we could potentially partner with focused on consumerism. So I really make it a point to attend these shows. And health is a great example of one where you can really see what's new and innovative out there. Shamelessly, I like to copy ideas that I see too.
Smart. Get to market faster.
Yeah, but definitely just kind of walking around. I walk the show end to end. I look from the giant booths from the big companies to the small startup pavilions and really try to understand, what the trends are as well as how people are addressing them. So like the new trend in consumerism, right? It's been around for a long time, but it seemed during the pandemic to get a lot of focus on the patients and that the patient is your customer, and seeing how different companies are approaching it from messaging, automation, AI to better understand how to serve them. Some things that exist in other industries that are kind of now making their way into healthcare, like retail, which is very kind of consumer centric. Yeah. So it's interesting to see.
Yeah, and I do recommend, obviously, attending these conferences are great ways to learn, great ways to stay in touch with your peers, stay in the forefront of how healthcare or how your industry is evolving, but obviously ours is healthcare and digital health and health IT. Mm-hmm. But also to really see where markets, we talk about there's hype and then there's also kind of where the rubber meets the road. And you can kind of see that as you walk around, you can still see some of the hype aspects and what's being hyped without a lot of substance behind it. But also it's kind of cool to see where some of this is really starting to get traction and what tangible results and real case studies that people have gone through now and could even be a year or two old and being tweaked as we go around. And so I'm starting to see more and more of that. And it's kind of, there's a great a picture yesterday on social media with Mickey Tripathi, who talks about we're basically coming out of, we had this great hype cycle with some policy, and not hype in a bad way, but we kind of built up and we went through this great cycle. And then with Meaningful Use Stage 2, we kind of lost the luster a little bit of heavy regulation. And now we're coming out onto this journey of more, of a lot of this stuff coming together. Now a lot of the hard work has been laid, a lot of that foundation has been laid. And now we're starting to really see more of the fruitions of, with meaningful use or just people using technology. I know meaningful use is a four-letter word in a lot of ways to a lot of care providers. And I understand that. However, the infrastructure that we built is allowing us to do precision medicine. It's allowing us to have interoperable systems.
Absolutely.
It's allowing us to share data. It's allowing us to get better data in the hands of providers, better data in the hands of payers, better data in the hands of patients. So you just brought up that patient journey. So that's what all that did. I know it was very painful 10 years, but we're coming out of it. We're seeing a lot of the fruits of the labor, and it's very exciting. And so there's been a couple of talks in the last 24 hours on that exact journey, and it's very positive. And so there's I don't see tons more policy coming out. We had a very large dinner last night of just people coming together who had worked on a lot of that stuff throughout the last 10 to 15 years. And the good thing is we don't see tons of new policy, but we do see us tweaking and making the policy that we created over the last 10, 15 years, 20 years better. And that's really exciting because that's really where, our patients deserve it and certainly our community deserves it.
Absolutely. And it's the natural evolution of an idea. It reminds me of when population health kind of came out as a buzzword years and years ago.
Right. Yep.
Everybody's like, we're doing pop health. And no one really kind of knew what they were doing. And now it's actionable. It's very specific reports and it's actionable in clinical ways and financial ways, operational ways. So really the evolution of an idea. So precision medicine also is like, this is a great idea. The science supports it. And how do we make it actionable? How can we turn that into something people can use on a day-to-day basis to better their lives and their health. And we're there.
Yep.
We're there, and it continues to grow. It's a great space.
It's very true. So I just actually pulled up this slide from that Mickey was presenting yesterday, and it literally says the slope of enlightenment. So that's where we are right now. We went through, obviously, the High-Tech Act and the Meaningful Use Stage 1, 2, and Stage 3, then 21st Century Cures Act. And I do want to dive into interoperability a little bit here because I know that's not spoken about as much, but it's fueling almost everything that we see on this show floor. But we don't talk about it as much. There are still barriers out there. We certainly understand that. There's a lot of people doing a lot of good work to break down those barriers. But what's enabling and fueling a lot of what we see here is interoperability. And that's where the 21st Century Cures Act. So the part that Mickey spoke on yesterday was the 21st century digital healthcare system and that slope of environment and a plateau of productivity. So again, slope of enlightenment, which I totally agree. We're basically coming into that with, all these cool innovations that are leveraging a lot of that we built over the last 10, 15, 20 years in this plateau of productivity. So you're going to hear a lot more of that in the coming years. I know from the ONC, from Mickey, and a lot of others, but it's really cool to see that, and I completely agree and support it.
Yeah, the challenge with interoperability is it's not sexy, and it's behind the scenes. It's not very visual.
Yep.
It's connecting different systems together. So this all happens, under the hood with the wires, and it's hard.
Yep.
And it's, you have different companies, different policies, different data that doesn't line up. I was at a lab conference, and they were saying all the labs track their information differently. So it's hard to come up with a lab information exchange because everybody, we get into the science, it's a lot of data and they don't all map it the same way. So interoperability has always been a challenge in a lot of industries, specifically in healthcare that has a lot of information, both clinical and operational. And really, you have to innovate to do it effectively. And it's not going away anytime soon.
Yeah, you and I were catching up off air, and you brought up, how not only interoperability is important to you and how it's a real hot button and why you're growing so quickly, but also you brought up, the lab is one of the last bastions in healthcare that's still on paper. So not only are you, if you do, curate or collect data or have data, it may not be stored in any discrete manner, but then you have a lot of paper as well, which is almost impossible for interoperability.
Yeah.
So it's kind of, give me a couple seconds on that and what that means to you.
Well, definitely if you're a fax repair salesman, healthcare is your spot because there's a lot of paper there. And labs, when you're dealing with a giant hospital and you want to communicate outside, it's worth the effort to integrate systems and do that interoperability. When you're a lab servicing provider groups, a regional lab, a national lab, it becomes tricky because your customers are on hundreds or thousands of different systems. It's not feasible to connect to everyone. So you just kind of give up and you just deal with paper and other things. And really, you want to come with innovative approaches where you look at where does the information come from and who needs it and what point of time. A lot of the information comes from the patient. Patients are trained today to give their information.
Absolutely.
And, why have the provider staff, put in information that the patient just, can do themselves.
Yep.
And I've seen that myself. I would go to a specialist office, fill out forms, and then go next door to the lab and fill out forms. And I just fill this out. Can I just get a photocopy and walk over with it, or even better, have it connect? So we see that in life today. And one of the reasons we founded the company was to kind of focus on that area, the lab space, and really provide a better connected digital journey to make things better. And when you provide interoperability, you're reducing work that's needed to deal with the paper. You're increasing patient safety from all the human errors that are related to paper. And it's better for everybody. There's no downside. It's just a little hard.
It's cool. No, it's great. So for those that may have joined a little late today, my special guest is Mark Dorner, founder and CEO of Precise MDX. So tell us about Precise MDX and specific what problems you're solving in healthcare.
Yeah, so we started Precise MDX really to create that connected digital journey between patients, providers, and labs. So to get them away from paper and getting all the benefits from making things electronic, this really elevates the experience for everyone involved and provides access and opportunities that don't exist in a non-integrated world. So for example, for patients, they are able to track their tests as well as understand the cost of healthcare up front. Two very important things that they don't have access to when it's revolved around paper. Providers, the care providers, physicians who are ordering the tests, less work, and also greater visibility into the testing flow. Where's the test? When's it coming back? And of course, the laboratories have a huge benefit in reduced overhead, increased patient safety, and significant growth because people want to do business with innovative labs that are easier to do business with. So that's kind of really why we got into the space, just to solve that problem. And it's a big problem.
How do you solve for pricing transparency? That's been around for a while. People have tried it. What makes you different?
Well, first of all, we have a lot of experience in healthcare. We've been doing this for 25 years. We know how to put together patient estimators, look at their insurance, understand the cost of services. I like to say it's not rocket science, but it's not easy.
Yeah.
With the No Surprise Act that came out this year, healthcare providers have to do it. They have to provide good faith estimates to patients. And I was reading a recent survey that said 35% of patients are not getting care. They're not seeking care because of the uncertainty of the cost. It's not that they checked and it was too expensive.
Right.
They're just like, you know what? I can just live with this because I know healthcare is expensive.
We've all done that. That 35% is a very low number. We all do that. I've done that this year. I was supposed to do some routine tests. I don't haven't found the time, but also how much is that going to cost me? This $1,000 or $100? It's somewhere in there. It's in $1,200. I don't know.
Well, your provider usually doesn't know.
No.
And definitely if they're not the one billing for it, it's a lab.
Yeah.
I mean, I just got my annual wellness checkup and I wanted to do an extra mercury test because I eat a lot of sushi. And I heard that if I ate a lot of sushi, I could get mercury poisoning and forget things like getting mercury tested.
Yep.
And the doc said, well, I know it's not part of your annual wellness, is it? Don't ask me how much it costs. I have no idea. And I have no idea how long it's going to take. But do you want it? I was like,
I don't know.
I was like, okay.
Right.
And, interestingly enough, one of my colleagues just got a whole bunch of lab work done. And he got this huge surprise bill. And he called them and said, you didn't give me a good faith estimate. And I don't have to pay. And the lab was like, and they were part of a health system. They're like, yeah, you're right. Don't pay.
Oh, wow.
He used the rule against them. And they knew about it, but they just couldn't technically
they didn't want to
figure
deal with
it out.
Yeah, exactly.
Yeah. But now, you know what happens with these rules and compliance. HIPAA came out. People are like, HIPAA, it's not a big deal. All of a sudden, fines, enforcement.
That's right.
Oh, now it's important.
Yeah, exactly.
So the No Surprise Act, which is a very, very good act. Yep. People have the right to know how much things cost before they buy them.
Yeah.
Imagine going to a restaurant and saying, well, when you're done eating, we'll let you know how much it costs.
Yeah. No one would do that. So what does, I like to ask this to my guests when I have time, what makes you better in Precise MDX and what's your superpower as a company?
That's a hard question. I think it's a combination of things. So, we definitely have a lot of experience in enterprise healthcare. We've been doing it for decades. Some of us, a lot of decades. I'm pretty old. And we work really hard and we listen to our customers. Mm-hmm. So I don't know if that's a superpower, but we definitely know where to focus. So we constantly go back and saying, is the product and service we're providing, is it helping you? Is it making life better? Is it not? And we constantly, when you focus on that, things tend to work out.
Yeah. No, that's actually very smart. There's wisdom in that for sure.
Mm-hmm.
So, and I think this is probably a follow-up, but 50% of my listeners are C-suite healthcare executives and most are entrepreneurs. So what advice or leadership would you share with them?
I mean, really just what I said about, listening to your customers. Mm-hmm. I think it's key and not being afraid to pivot. So, we go down paths with product, we develop as a startup, and when you innovate, you can't copy stuff, right? You're innovating. So you kind of come up with an idea and you build it and you go out there and see how people respond. But you have to really be ready to be like, yeah, that one, that didn't work.
Right.
People don't like that. They don't care about it. Let's cut our losses and proceed in a direction that does matter. So really just constantly listening to the customers, being able to have that feedback loop is really key. And it actually promotes good relationships. They know you care about what they want and you're really focused on making it better for them.
Yeah, and I want to take a second on that because you are a product founder yourself and you have been for many years and you even said decades because you're older. People get founderitis where they have a really good idea and they're wed to their idea and they know, then they're smart and so they're kind of wed to that. They don't pivot. They say, well, they should know and no, this is the way. And you don't tell that person what you want them to know. You listen to what they want and you meld that together. And that's what pivoting is all about. Mm-hmm. But a lot of founders don't do that. And that's why 9 out of 10 companies fail.
Yes.
90% fail.
Yeah.
So you got to be that extra, you got to have a superpower to get past that.
I mean, listening is a superpower.
It is.
Yes.
It is. Excellent point. I love it. So what's the one thing that you've learned over the past 25 years that you wish you had learned in year one?
Oh, well, what you just said about not getting married to your idea and trying to convince people, but you don't understand. This is better for you. And they're like, no, it's not. No, you just don't understand. Yeah. Because I know it's better for you.
I've heard all that. Yeah.
Yeah. And no, that's not true.
Good.
Because either it's not better for them or you're not explaining it the right way.
Mm-hmm.
And maybe they don't understand. Maybe you need to approach it, or maybe like, you just need to listen. And of course, early on when I started my career, I didn't listen. I thought I knew everything. And now, even though I think I know everything, I don't say it out loud on a radio show.
Perfect. Love that. Hey, transparency and honesty goes a long way.
Absolutely.
That's excellent. Being self-aware, even better. No, I think that's, listening is not just a great feature, in this context, but also I have a lot of people who also are in sales that listen to my radio show, and that's a really important trait. So again, not even being a good leader, not being a good CEO or board member, but also being just a good, on the sales side. Salespeople get very proud of what they have. They love, we have 18 great products, or we have 5 great products or functionalities, and they don't take time to actually listen and solve the problem. They want to sell what they have, not listen to the problem and then solve the customer's problem. You'll get your deal done probably 2 to 3 times faster. You actually solve their problem, not sell what you have. Because there should be a middle. Obviously, you got to solve their problems with your technology, but it's about listening.
And people can sense if you really care about their well-being or not.
Very true.
Like when we go out there with companies and products, and this one also, we want to make things better and easier for our customers. So we care. And when you sit with them, they can feel that. You're listening to them. You can't always succeed, but if they know you care and you're trying, that you have their best interests at heart, that's what's important. And if you have a good product, it should be able to do that.
Very true. Got 2 minutes left or so. Let's pull out the crystal ball.
Uh-oh.
My audience loves this, and I love this segment. I can't get to the whole segment because I usually do a whole show on just these couple of questions. But what do you see as some of the major themes, maybe that we haven't seen here at Health, or that's coming out in the next 6 to 12 months that we may not be thinking about?
I mean, if you look at healthcare, your customer is the patient. Mm-hmm. That's it.
That's right.
They're the patient. Yep. Right? You have intermediaries who your customer and your customers, but it's really the patient. And you have to look at what are consumers concerned about. A lot of people are worried about a recession. Mm-hmm. A lot of people are worried about crypto, but I don't. But a lot of people are worried about recession. And when they worry about recession, they look at costs and they get more demanding. They're like, if I'm going to spend this money during this time when things are tough, I definitely want to get my value. So I want to get good service, and so I think the trends on consumerism and just transparency in healthcare around pricing are going to continue to grow and be a big deal, and that also relates to the outcome side, clinical outcomes. Mm-hmm. So patients go on different services to look up physician rankings and social media. And, my wife's a doctor and she hates social media because, one patient could not find parking and give her 3 stars.
Exactly.
But that's what patients look for these days.
Right.
And people need to wake up and realize it.
It's cool. I completely agree. And I think you hit on something with pricing. Even on my way out here, I was running out the door and I got a text from a good friend of mine back in Atlanta, and he said, "Hey, I know that you're deep in, healthcare and services." And he's like, "I got to get a better solution for my insurance. I'm getting killed. I get my new rates for next year. I'm about to get clobbered. There's got to be a better way." And he's a healthy person, and his rates have gone up like 42%.
Oh yeah.
And I said, "Absolutely."
Everybody's has.
Yeah. I said, I've got a few options for you.
And good luck figuring out if you're ready to go from a PPO to an HMO. Like, am I healthy enough? Am I sick enough? Will physicians want me as a patient? It's hard.
Yeah. No, I love I have my Hip Nation strategy, and all my people in the Southeast use it. It's a great way to reduce your costs and just get much better care from a personalized doctor. So. Mm-hmm. No, I look forward to that conversation. But you're spot on. It was all about cost and pricing. So I think with this pricing transparency and this estimator, it's going to be very timely also coming into a recession. I think no matter what, we're going to hit some type of recession. Real quickly, got 1 minute left. Do you plan to attend Vive in Nashville next year?
Yep. Got my tickets already. Love Nashville. So I'm looking forward to it. It's in March 26th.
Yeah. I'm booked as well. So I'll look forward to it. Now, I'll make the announcement. I'll be broadcasting my show live from the Vive conference next year. Steve Lieber will be one of my guests. I think many of you know Steve, a longtime industry veteran. He's actually part of the Vive organization now and helping them strategically grow. But he'll be one of my first guests. I would love to have you on air at Vive as well, if you have time.
I always have time for you, Justin.
We'll check with Amanda before you say that.
Yes, sir. Yeah, my boss.
Exactly. Well, very cool. Well, thank you, my friend, for joining us in studio. So what are you off to this afternoon? What do you got? I like to walk the floor. I'm going to walk the floor, get a bunch of meetings, but just kind of seeing what's out there. Yeah. And you have a team here?
Oh, yeah. A bunch of my colleagues are here. They're running around. They're working. I'm just walking the floor.
Yeah. Well, there's a lot to see. I don't even know. 300 booths? I think it's like 300 and something booths are here.
We'll see how many steps I can get in.
I'm already at 8,000.
Nice.
And I haven't and we've still got half the day to go. So very cool. Well, I hope you enjoy the rest. Again, thank you so much for taking time out to join me in studio here. And thank you very much to our very cool producer over here. This has been awesome, and we're actually, just so everybody knows, to visualize where we are. And we'll try to publish some pictures here, but we are in a really cool glass bubble in the middle of the show floor, and so we're like in a fish tank or a fish bowl where everybody can see us.
The aquarium.
So love it. But very, very cool. So thank you, everybody, for tuning in. And obviously, you can catch us weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HLT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, and TuneIn. We've also just revamped our JustinBarnes.com site, so you can check that out, and we're posting some new content there as well. Thanks, everyone, and stay safe. Enjoy the rest of your week.